this heart meeting the demands that are placed upon it, there's a lot of math that's involved, and they take all of these numbers from the information that they can get, and they'll do math, and they'll determine the effectiveness of your heart. One of the numbers that we use is our heart rate, our pulse. Go to the doctor, what do? After they, check your temperature, do your blood pressure, and then, and I'm sort of like, are they hitting the right area? Are they actually testing anything? But then, is this like the only place that you can feel it? You got other places that you can feel it, okay? Other areas that you can feel the pulse. The surge of pressure. Pressure from what side of the heart? The left. Because that's the part that's going to systemic circulation. So it's that left side of the heart moving through that aorta. And don't forget, the left side of the heart has the most cardiac muscle. Okay, so when it beats, whoosh, it's a strong beat. Babies, kind of a high heart rate. Adult females, 72 to 80. Males, 64 to 72. Then you get to be my age, and it starts to go up a little bit. Okay. I'm technically over the hill. So, when we have heart rate, how old do you think I am?
23.
Oh, dude, you could talk well. Oh, mom trained. Okay, good. Way to go, Mom. How? You're not supposed to say that much.
How much is this?
32.
I'm officially 51, so I am officially over that peak. Okay, so see, I'm no longer on the young side, I'm on the elderly side. So, just saying. Now, heart rate. You guys have probably heard of tachycardia, right? Bradycardia, okay? Beating too fast, beating too low. Tachycardia, if it's over 100 beats per minute at rest, there's it's beating too fast. This could be stress, anxiety. Mine is definitely doing that right now because I still haven't broken my fever from the weekend yet. Okay, so I can tell. It could also be heart disease. We could also see that a loss of blood. Now, a loss of blood to the myocardium, the actual cardiac cells. So that's going to be, you guys remember when we were talking about the blood flow? And the heart has its own blood flow to feed the tissues, okay? So what happens at the time of a heart attack? I'm asking about the heart rate right now. It increases because blood flow has been cut off to the tissues, and what is it trying to do? Compensate, get the blood back to those tissues. So that could be an indicator of something. bradycardia below 60 at rest, usually at the time of sleep, a low body temperature, but it's not always a bad thing. That person who trained for that decathlon, his heart rate is probably, you're probably like, are you even alive? It could actually be something like 40 beats per minute. Someone like me, I wouldn't be getting enough blood flow and materials to the tissues. But for that person who's trained, that's perfect for them. Exactly. And those tissues, they basically accommodate that low flow, that low beat. There are different materials that can raise the heart rate, some that can lower the heart rate. Positive and negative chronotropic agents, these are just going to be anything. That's why I said materials, okay? Because if you think inside, outside, medication, whatever the case might be, okay, it can affect the heart rate positively or negatively. Our nervous system produces some of these agents that affect the heart rate. Now, remember, the heartbeat does not require any input from the nervous system, but the nervous system will affect the heartbeat. The autonomic nervous system, what comes to mind when you hear that? Our sympathetic, parasympathetic. That means fibers from this nervous system. All right? So we're going to have the parasympathetic and sympathetic fibers. It will affect the heartbeat in the reticular formation. Do you remember that? It's like this diffuse webbing that occurs, okay, in our medulla oblongata. Okay? Why the alligators? Mama said. Now, cardiac center, medulla oblongata. What part of the brain am I in? Which is the primitive part. Okay? So it's monitoring this. You don't have to pay attention to it. All right? That will watch out for the heartbeat. Some of their effects, cardiostimulatory, increase that heart rate. That's our sympathetic. Some of it inhibit it. That is our parasympathetic. When we look at what some of the agents are from the sympathetic and the parasympathetic systems, the sympathetic, do you guys remember the preganglionic and postganglionic fibers? How we have like that chain, the sympathetic chain, and then you've got like thoracolumbar, craniosacral, that sort of thing, okay? Got the pre, then the post. And the sympathetic division the post fibers, they're considered adrenergic. Do you happen to remember what that term means? Think about your adrenaline, okay? Adrenaline increases everything. They're releasing the norepinephrine. Norepinephrine, do you guys remember that that's a precursor to the epinephrine? All right? Now, alpha, beta, you know the Greek symbols, right? Okay? The post bind to fibers of the heart. So that means we've got that norepinephrine making it to the fibers of the heart. Do you guys remember these like C-amp cycles? Like if it attaches, it sets off a series of reactions within the cell, okay? It sets off this series of reactions within the cell. So therefore, it's going to affect the cardiac muscle itself. But then, look at that. What node? Why is it my SA node? Because my SA node is also known as the what of the heart? Our pacemaker of the heart. So there's no control over what's happening, but there is an effect of what takes place. Does that make sense? So, if we have the release of these agents, what we begin to do is we set off a series of reactions in those cells. If we set off the series of reactions in that SA node, and the SA node is the pacemaker of the heart, look at this. Because of norepinephrine affecting the heart rate, it can send it quite high. Anybody ever had a heartbeat that high? You get to 180 and you're feeling like you're just going to die because you've got that increased heart rate, you've got that increased blood flow, you've got the increased respiration. It's like you almost can't even catch your breath. You not just sit down, you just want to roll. Yeah. Can you imagine 230? I can't. Because at about that point, actually at about 180, I think, you run the risk of the heart attack.
You can have a heart attack while you exercise.
Yeah.
Just because you exercise.
Mm-hmm. Yep.
Exercise.
Yeah.
Consult with the doctor.
Well, that and